Hi, my name is Andrew. I'm 32 years old, and I had a microdiscectomy 4 days ago on September 23rd, 2014. And I'm just going to talk about that experience as well as leading up to that experience, the pain that I was having. I'm going to keep these videos pretty short, probably 5 or 6 minutes at the most. Um, my surgery was done at Northwestern Medicine in Chicago, Illinois, by Dr. Zachary Smith. Um, Leading up to the surgery, I started having pain in my back in May. I didn't think much of it. As June came, the pain sort of spread from my lower back to my glutes, my hamstring. Again, I was just considering it a muscle strain. Started seeing a masseuse, clinical massages, physical therapy, chiropractor, all of that conservative stuff that does work for most people in most circumstances, and has worked for me in the past as well. However, by the end of June, my physical therapist was starting to get concerned that it might be a herniated disc, which was not what I wanted to hear, but ultimately ended up to be the truth. Um, uh, by mid to late July, I started getting some signs of sciatica, the burning down the leg. If you have sciatica, you know what the experience is like. I don't need to explain it to you, but it's the worst. It's just terrible. Um, in By late July, it got to the point where I wasn't really able to do physical therapy anymore, and uh, final blow was I had sneezed on my couch, and it actually pushed that disc out to the point where the pain was excruciating. Um, that was a Sunday. The next day, I went to the doctor and requested an MRI. The MRI revealed a huge herniated disc at the L5S1 level, which is a very common place for these discs to herniate. Um, at this point, I had to move in with my girlfriend because I was unable to really do the stuff I needed to do on my own, groceries, cooking, getting around, without a little bit of assistance. Um, and I also started contacting doctors, surgeons, pain management doctors, um, just so I could begin to fix this issue. Um, as it turned out, I spoke with Dr. Zachary Smith at Northwestern. He suggested surgery right out of the gate. However, he was willing to let me try some conservative methods. Um, so I did do an epidural steroid injection. It helped for about 4 or 5 days. It reduced my sciatic pain by about 30%. However, about 10 days after that, which would have probably been September 10th or so, uh, the shot had wore off and the pain had come back full force. By September 18th, I was completely bedridden. I was unable to walk for more than 10 seconds, and I used those 10 seconds to walk to the bathroom and attempt to go to the bathroom, which was painfully experienced in its own. So I was in bad shape at this point. My family had come to Chicago to help me get through until September 23rd, which was when my surgery date was. Getting me to the hospital on the 23rd was an experience in itself. We had to rent an SUV because I live in the city. I don't drive or anything like that. I basically plopped in the back seat and laid down. They got me to the hospital, hopped in a wheelchair up to the surgery department. Within 10 minutes, they had me laying down in the bed, and were pumping some pain medication into me. Um, so the surgery itself was delayed about an hour. The patient before me required a little extra time. Uh, by this point, it was probably 3 or 4 p.m. I had my surgery. I obviously don't remember anything from that. I was under anesthesia. Um, when I woke up, I remember moving my feet and my legs, um, and not feeling the same pain that I felt coming in. And I was still really out of it by the time they walked me into, or they rolled me into my room where I would end up staying the night. Um, the family was there, and I was just catching up with them. I still hadn't moved much. I stayed the night at the hospital because the surgery took place so late in the evening, and also because I had some drainage in my back and spine. This happens about 10% of the time. It's not considered dangerous, it's just you have to lay on your back for 24 hours to correct it. Otherwise, you'll get a massive headache if you try to sit up. So I stayed the night, the first night, and then at the end of the second day, I stood up and walked for the first time. I felt almost no pain. It was an amazing moment that I was able to share with my family, and it felt great. Obviously, very slow steps, very guided steps with my nurse. I decided to stay a second night just because, I was comfortable there. The nurses were treating me great. The doctors were treating me great. And I continued to get up and walk the second day I was there as well. Came home the third day. I actually walked about a mile. It was beautiful out, so I took advantage of that. And that brings us to the fourth day, which is today. I wake up, I'm a little sore, especially in the hip and especially where my incision was, but that's to be expected. My legs are just sore from being bedridden for most of a week, but I plan to take a walk today, another mile or so, and come home and relax for the rest of the day. I'll keep you guys posted. If you have any questions, leave them in the comments. I'm definitely happy to answer those and go into more detail with my experience with this injury. Take care. Get well soon.